Assalamualaikum doctors. In this video I can discuss how can we manage a schonlein purpora patient. First, we know schonlein purpora patient can come with the features of fever, there is rash, specific pattern of rash. They have headache features because of high blood pressures. They have hematuria because kidney affections occur, and rash is very important. The distribution of rash we know. Arthritis, difficulty in walking or limping. These are the features of schonlein purpora. In male, there is private part swelling, orchitis. So I receive a patient with schonlein purpora. First, we will take the history. After taking the history, I will examination the patient, like examine the vitals, especially the blood pressures. It is not an emergency, but if child has some neurological any problem, then ABCD, of course. Abdomen examination, general examination from head to toe, especially the rashes, musculoskeletal examinations, then swelling of any private area present or not if it is boy. Then we will do some investigations. Examination on the bedside, we do the blood pressure and urine dipstick. Very important, blood pressure and urine dipstick. If proteinuria, send urine for early morning protein creatinine ratio. If hematuria, send urine microscopy. And additional investigations are blood test if urinalysis abnormal or diagnosis is uncertain. This is full blood count plus fin, urea and electrolyte and albumin. Okay. If fever, blood culture and ASO titer, coagulation profile and throat swab. So when I will do these investigations, blood pressure, urine dipstick, these are tests I will do, and then I will check the child is I admit or not. For admissions, this child there are some indications. First of all, if I find orchitis, moderate to severe abdominal pain, arthritis involving more than 2 joints, proteinuria, clear evidence of gastrointestinal bleeding and inability to ambulate. Again, orchitis, moderate to severe abdominal pain, involvement of more than 2 joint, proteinuria, and then clear evidence of GIT bleeding and inability to ambulate. And when we refer to rheumatologist, if atypical or rapidly evolving rash, and refer to nephrologist. When we involve the nephrologist, if there is number 1 urinalysis blood or early morning protein more than 1 plus after 6 months. So after 6 months we will be keep follow up, and after 6 months protein present on the urine, so we follow up. Then macroscopic hematuria or heavy proteinuria at presentations, hypertensions, significant proteinuria, that is early morning protein urine creatinine ratio more than 100 gram per millimole or 3 plus proteinuria for 3 days and impaired renal functions. So treatment, first I already tell the indication according to if needed admissions. What is the treatment we give? First of all, joint pain we give the NSAID, non-steroidal anti-inflammatory drugs. Ibuprofen is first line. Use it with caution if renal involvement or patient is asthmatic. For abdominal pain, we give prednisolone 1 mg per kg per day, maximum 60 mg per day for 2 weeks. So prednisolone we are giving 1 mg per kg per day, maximum 60 mg per day for 2 weeks. Renal involvement not a contraindications. If severe and persist, exclude the pancreatitis, intussusception or spontaneous bowel perforation. So remember, in schonlein purpora, child comes with severe abdominal pain. What are the reasons? Can be perforation, intussusceptions, then pancreatitis. Then after treatment, we give for joint pain NSAID and prednisolone. Then we will monitor the child. Monitoring depends on uncomplicated and complicated case. If it is uncomplicated schonlein purpora, where urine analysis show less than or equal 1 plus blood and urine protein and normal blood pressure, no hospital follow-up required, but GP follow-up in 1 to 2 weeks, monthly blood pressure for 6 months and weekly urine dipstick at home until urine is clear. So 6-month follow-up on the gym, uncomplicated cases, monthly blood pressure monitor and urine dipstick until clear they will do. Okay. Then schonlein purpora with hematuria or proteinuria more than one and normal renal function test. So they have a complicated case, hematuria, proteinuria more than one. As above, 6 months will be follow up, but it is children outpatient we will do. That is children doctor, children GP will be see, monitor the blood pressure and urine dipstick. Discharge and follow-up inform the parents conditions may fluctuate for several months but recurrence rare once settled properly. Very rare risk of renal failure, that is 1 to 3%, hence importance of monitoring urine. Seek medical advice if child develop headache, pararectal bleeding and severe abdominal pain. Also we give some advice during discharge. Seek medical advice when child develop any headache, abdominal pain and any pararectal bleeding. Because we know headache, pararectal bleeding because of intersusception develop, severe abdominal pain, we know perforation, pancreatitis, intersusception develop. So these are the features when we discharge home. If develop, seek medical advice. Uncompleted schonlein purpura, we know GP follow-up as above, and discharge from GP follow-up if urine analysis and blood pressure is normal after 6 months of onset. So this is how can we manage HSP. Thank you.